Liver disease patients, advocates, and government leaders in health joined together prior to the AASLD liver meeting in Washington, D.C. for the first International Rally for Liver Disease Awareness. Dr. T. Jake Liang of the NIH discussed the important role physicians play in screening and educating patients about liver disease, particularly hepatitis C in baby boomers.
More than half of the people infected with hepatitis C don't know they actually have hepatitis C, and that was one of the reasons that this particular guideline has been proposed by CDC, just to basically try to diagnose those people who don't have any awareness of their chronic hepatitis C. And as you know, that the hepatitis C can lead to end-stage liver disease, liver transplantation, liver failure, as well as liver cancer. So very often what we see in the clinic is that people come to us when they're such a late stage of hepatitis C, and that's one of the reasons that we want to raise awareness, increase testing, so at least to bring those people who were infected with hepatitis C into the medical healthcare system, not necessarily to treat all of them, but basically just to manage them, trying to monitor them, and for those who need treatment during the monitoring, they should be treated, and for those don't, I think we can continue to monitor them just like any other kind of chronic disease. You basically manage them appropriately.
Dr. Liang expects this year's liver meeting to be an exciting one, as a number of new treatment options and promising research are being showcased.
There are just a lot of exciting advances, and particularly in treatment of viral hepatitis, and I think that would be, if you want to kind of ask me what's the most exciting area of, I would say that would be it. But certainly there are a lot of other advances in research that are done in all other forms of liver disease, including fatty liver disease, including liver cancer, autoimmune liver disease, and various other forms of liver disease that we are making major advances in those areas.
Dr. Melanie B. Thomas, a clinical oncologist at the Medical University of South Carolina, stressed the value of interdisciplinary care for liver disease patients.
Those patients are best served by multidisciplinary care. So make sure that, should they see a transplant surgeon, should they be referred to a large center of excellence in liver disease, because it's really very different than managing some of the other malignancies. So, again, multidisciplinary care, including surgical team, radiation oncology, interventional radiology, and the other message is to think about clinical trials for those patients, because there's only one chemotherapy drug that's approved, and we need those patients to be considered for trials.
During the rally, Dr. Howard Koh of the U.S. Department of Health and Human Services outlined 10 successful government initiatives that have improved research, education, and public outreach for liver disease.
First, we are very proud to say that we have now had World Hepatitis Day celebrations at the White House for 3 years in a row. Second, the President of the United States has released proclamations about the importance of hepatitis awareness, early detection, and treatment. Third, we have had outstanding congressional support from both sides of the aisle. We're very grateful to our congressional leaders. Fourth, we have launched an annual National Hepatitis Testing Day that's really raised awareness. Fifth, we've had approval and now implementation of new baby boomer screening recommendations for hepatitis C. Sixth, we've had expansion of hepatitis outreach for Asian American and Pacific Islander populations. Seventh, we've launched greater attention to Hep C for intravenous drug users, tackling that issue dead on. Eighth, we have greater attention to opposing discrimination against health professionals, particularly students who are chronically infected. Ninth, we have greater commitment to eliminating perinatal hepatitis B transmission, emphasizing the importance of a birth dose in hospitals. I like that theme because that's prevention at birth. And 10th, very, very importantly, as you well know, we have great progress with respect to new treatments for hepatitis C and new FDA-approved modalities.